Welcome back to part two of heart attack education. Welcome back to part two. Have you watched part one? Hmm. Run, watch part one of heart attack education. Now, like I said in previous video that I did, the part one, let's go to prevention of heart attack. This is the one that I get so excited because this is what I do as a nurse, to educate people about this process. Okay, so let's go right into it. But before we start, have you subscribed to my YouTube channel? Run to YouTube, subscribe. It's called Health Talk Queen 1, Health Talk Queen 1, and my TikTok is called Health Talk Queen. Please subscribe, follow, like, share, turn on the post notification so you can get notified. You don't want to miss out the yummy thing. Let's go right into it. The first one is they want us to, for heart attack prevention, follow healthy diet. It's always my number one thing in all this health disease process that I'm bringing to you guys. You need to modify your diet to prevent heart attack. Eat healthy, less salt, less sugar, less carbohydrate, more protein, vitamins, just eat balanced diet. Watch what you eat, especially when you're getting older. You want to really pay attention to your food. Very, very important. Pay attention so to prevent heart attack. The second one is health condition. Control it. If you have diabetes, control your diabetes. If you have hypertension, watch out. Control your high blood pressure. So whatever health condition you have. Like if you have autoimmune disease, control it too. So that way you can prevent yourself from heart attack. That's it. Your high blood pressure, diabetes, those are the two things that is very, very common when it comes to heart attack. Once you control it, the others will be also controlled, and then you'll be less um, at risk for heart attack. The next one is they want us to quit smoking. Yes, quit smoking. Like I said, in this aspect, the choice is yours. Do you want to live healthy? Do you want to have a heart attack? The choice is yours. So quit smoking. Smokers are liable to die young. You don't want to smoke. The next one is management of stress. You need to manage stress. I have a video in my TikTok and YouTube. Watch it. Stress management, very important because it can lead to heart attack. When you overwork yourself, you don't give yourself rest, it can lead to heart attack. The next one is knowing the warning sign. I talked about signs and symptoms. Once you know the warning sign of any disease process, that you already have that education knowledge at the back of your mind. So for it to occur, it will be very, very high. Except there are some disease condition that we cannot eliminate, but education is powerful and it's the key, and it's also the major role in prevention. So if you know the signs and symptoms, you're good to go. Also, we consider genetic testing. Consider genetic testing. Make sure you talk to your primary care doctor if you have family history of heart attack, so they can put it in your chart, so that if you're doing procedure or you want to undergo procedure or childbirth or anything, they will know. If you're pregnant and you have preeclampsia, eclampsia, let your primary care know, and also talk to your healthcare primary, not the OB, the healthcare primary doctor, so they can put it in your chart too, because it also can lead to heart attack. So it's very important, health history, very important also to update your doctor about it. The next one is medication. There are some medication once somebody have first heart attack, there are some medication that they can give you also to manage it. I'm not going to talk about that. I don't talk about medication in my live or recorded video, but liaise with your doctor so they can give you some medication like a blood thinner, like other medication which I don't want to talk about. They can give you, so that way it will prevent it and also manage it if you have the first heart attack. You don't want to have the second one, or you don't even want to have it at all. When you get to a certain age, there are some medication that they can give you that you have to be on to prevent it. Okay, so the next one is exercise. Very important, very important. Exercise. Exercise in all this health disease process is very important. I talked about it in almost all my video. You see, in my video, eating healthy, 80%, and then the other 20% is exercise. You don't have to break the bank to eat healthy. You can look for the healthy food in your own class at your own affordable rate. Eat healthy, exercise. You don't have to go to the gym if you don't have money for gym. I know it can be very, very expensive, but there are some gyms you can do within your house. You can look at video like YouTube video, Google video, that can help you to exercise. You don't have to go to the gym and be doing the zigzag, depending on how your health and your body can take it. As long as you are moving from point A to point B, you should be good to go. So it's very, very important. Now, you've done all this. Do me a favor, share this video. Tell people out there that heart attack is real. Once you have this knowledge at the back of your mind, you're good to go. There's another thing that I want to discuss about. It's called cardiopulmonary resuscitation, called CPR. CPR in the United States is of two parts. Usually you go for the class, you get the certification, and there is the card that they will give you. But there are some basic one that you can do that we all need to know. You don't even have to go to the class. We all need to know. I will try my best. I'm very busy, but I will try my best to see if I can do video of the basic one of CPR that you can know. But the best one to get, everybody needs to get CPR certification because it's very good. When somebody have heart attack, you should be able to perform CPR immediately, especially when they need it. There are some steps. If the patient is conscious, is unconscious, is having pulse or no pulse, how many push that you have to do, if it's the baby, if it's adult, it's a long intensive education, but it's cheaper. You can go to your local nurse or center where they do CPR and get the certification. Very important, So, and you don't know when you're gonna need it. You don't know. It might be your children that will need it one day. God forbid, but it might be your spouse, it might be your family member that need it. You should be able to perform CPR, which is cardiopulmonary resuscitation. Very important. Okay, so I will try my best and do some basic video, or if I see there's a video that I saw one day, I can repost it. Please check my reports. I can repost it where the nurse demonstrates how to do CPR. But the best one is to get certification, so that way you can get satisfied. We don't know when we're gonna need the CPR. I hope all this help, and I hope we're gonna be living healthy so we can kick out heart attack in our society and live healthy. We don't want to die of heart attack. When you're getting old, there are some lifestyle modification you have to do, especially when you're clocking 30 upward. You don't want to risk anything. Live healthy, exercise, eat, and stress free, and then you're good to go. Okay, till I see you in my next video, please subscribe to my YouTube channel, Health Talk Queen 1, and also follow me on TikTok, Health Talk Queen. Like, repost, share my work, and so other people can get empowered and we can live heart attack free. Okay, till I see you, remember, education is powerful and prevention is the best cure that you can do.